The committee will come to order. Without objection, the chair is authorized to declare a recess of the committee at any time. This hearing is entitled Homeless in America, Examining the Crisis and Solutions to End Homelessness. I now recognize myself for 3 minutes to give an opening statement. Today, this committee convenes for its first hearing of the 116th Congress. This hearing is on an extremely important subject, the national homelessness crisis. Today, there are over 500,000 people experiencing homelessness nationwide, and nearly 160,000 of them are children. Nearly 38,000 are veterans who we have failed to support after their service to our nation. The number of people experiencing chronic homelessness nationwide increased between 2017 and 2018. In Los Angeles County, there are over 50,000 people experiencing homelessness, nearly 5,000 of whom are children, and over 3,800 of whom are veterans. In the richest country in the world, it is simply unacceptable that we have people living in the streets. This is a crisis that requires action. I had my staff look at this committee's hearing records, and it appears that this is the very first time that the full committee has convened a hearing focused entirely on homelessness. So it is long overdue for this committee to turn its attention to this crisis and consider proactive solutions to ensure that every American has a safe, affordable place to call home. This is a top priority for me as chairwoman. We need Congress to have the political courage to step up and provide the resources and funding necessary to end homelessness. And the first step is to put forth proposals to address the problem and have a discussion. My bill, the Ending Homelessness Act, provides $13.27 billion in new funding over 5 years to federal programs and initiatives to prevent homelessness. It includes funding for new units of affordable housing, new vouchers, case management, and technical assistance. Today at this hearing, we will hear directly from experts and advocates regarding the continuing challenges in tackling homelessness in America and their recommendations on solutions. Before I yield to the ranking member, I would like to just take a moment to note the presence of Representative Katie Hill, the former executive director of the largest nonprofit in California that advocates for people experiencing homelessness. She also served on the governing and oversight body for the Los Angeles Continuum of Care, overseeing the use of federal homeless assistance funding, and she was instrumental in recent initiatives that will provide substantial new state and local funding homelessness in Los Angeles. The chair now recognizes the ranking member of the committee, the gentleman from North Carolina, Mr. McHenry, for 4 minutes for an opening statement.
Well, I want to thank Chairwoman Waters for hosting and bringing us together to talk about a really important issue for our country, for my home state in North Carolina, and for, I think, everyone's district represented here on this committee. And so I do think it's important that we highlight the need for a more concerted effort to combat homelessness. You know, according to the most recent data in 2018 that Chairwoman Waters highlighted from HUD, we have 552,830 of our fellow Americans that are homeless. Of that, nearly 10,000 are from my home state. Every state's touched, every community is touched by this. And while this represents a significant decrease since the first homelessness count in 2005, that count was 754,000. There's a dramatic reduction in homelessness from the initial count. But still, until we solve this problem, one is too many. And so I also want to highlight another subset of that large group, 194,487. That number represents the total number of people who are also unsheltered, meaning they're living in vehicles, tents, other makeshift dwellings in a variety of different places. And so I'm very interested to hear the testimony, not just on the problem, but on the solutions. What we can do as federal policymakers in concert with state and local officials to make sure that we have a proper response in dealing with this challenge. There's also another demographic group of that, the chronically homeless because of alcohol or drug addiction or mental illness, the victims of domestic violence who need a safe haven, the veterans who are out of his or her luck after serving our country, working families who cannot afford to live in the communities where they work, and the youth, whether those not living with families or those who are recently graduated who are trying to find shelter. And so today I hope that this will be the first of a robust discussion on this issue, where we can review all the programs under the Department of Housing and Urban Development and across our government as much as we can to determine if they are effective in addressing the homelessness challenge that we face across our nation. Additionally, we should explore new initiatives to engage the federal, state, local, nonprofit, and private market shareholders to develop holistic approaches that understand the humanity that's at risk here, the people and the challenges they face, including eliminating state and local barriers to affordable housing, and increase the supply of affordable housing. And while appropriate, we should, and where appropriate, we should explore how to allow localities the flexibility to tailor specific solutions to address the concerns that may not fit a federal one-size-fits-all approach. And so I look forward to the testimony and the questions today, and with that, I yield back.
Thank you very much. I will now recognize the subcommittee ranking member, Mr. Duffy, for 1 minute.
Thank you, Madam Chair. It's good to see you. Welcome, panel. I'm over here, upper left-hand corner. I think this is a great hearing. As the Chairwoman knows, and Mr. Cleaver knows, we've spent a lot of time working on homelessness, and specifically rural homelessness. And I think we have to have a broader conversation about what programs work and what programs don't work as well, and where do we streamline resources into the programs that help the most people. How much money do we spend to eradicate homelessness? And I'm proud that this committee has worked well together, maybe not on everything, but on homelessness, we actually did work well together. We passed the Family Self-Sufficiency Act. We did the Housing Choice Voucher Program. We did a lot of work trying to help those young people who are foster children who have a high propensity to go into homelessness. How do we direct them into housing so they don't start their adult lives off homeless? And I'll just say I want to thank Ms. Roman for coming to my district for a Homelessness and Hunger Summit. I'm grateful for that. The Secretary of HUD came to my district as well, and I have an open invitation to the Chairwoman to also come to my district and discuss rural homelessness. I yield back.
Thank you very much. I now recognize the gentlewoman from New York for 1 minute, Ms. Maloney.
I want to thank Chair Lady Waters so much for holding this hearing. We have not had a full committee hearing on homelessness in many, many years. So I am thrilled that this committee is having its very first hearing on this important issue. Homelessness is an enormous problem in this country. Nearly 1 in 7 people experiencing homelessness live in New York City, which I am privileged to represent, and it's a problem that demands immediate solutions. Roughly 78,000 people in New York City are homeless, yet New York City has one of the lowest rates of people that are homeless that are not sheltered. Only 5% of this 78,000 do not have a sheltered home. But we need to do far, far more. I am very pleased to be an original co-sponsor of the Chairlady's Ending Homelessness Act, which would provide over $13 billion in programs, the same as an aircraft carrier. Let's get our priorities straight.
I will now recognize Mr. Cleaver from Missouri.
Thank you, Madam Chair. I would like to thank you for having this hearing, and I think Ms. Maloney mentioned the uniqueness of dealing with this issue. But at the same time, I appreciate Mr. Duffy's work with me on the Housing Choice Voucher Mobility Demonstration Act. Tragically, I think we are precipitously moving toward the notion that we can do nothing about homelessness. And if we're going to have any discussion about homelessness, it will inevitably lead us to the discussion necessarily about affordable housing. We are in a crisis on affordable housing, and what I hope everybody understands is that as we remove affordable housing, it leads to homelessness. And so we've got to deal with that issue if we're going to deal with homelessness, and this is a good start. Thank you, Madam Chair, for this hearing.
Thank you very much. We will now move to our witnesses for today. We welcome the testimony of Ms. Carolyn Darley, Speaker Advocate with the National Coalition for the Homeless, Dr. David Lucas, Postdoctoral Research Fellow with the Institute for Entrepreneurial Society, Whitman School of Management at Syracuse University, Ms. Nan Roman, President and CEO of the National Alliance to End Homelessness, Ms. Anne Marie Oliva, Senior Policy Advisor with the Center for Supportive Services, Mr. Justin Rush, Public Policy Director for the True Colors Fund, and Mr. Joshua Stewart, Director of Policy with the National Coalition for Homeless Veterans. Without objection, your written statements will be made a part of the record. Ms. Darley, you are now recognized for 5 minutes to give an oral presentation of your testimony. Ms. Darley, is your microphone on?
Okay, thank you. Good morning, ladies and gentlemen. It is my pleasure to be here. I'm from the National Coalition for the Homeless. My name is Candy Darley. And what we do at the National Coalition for the Homeless through our Speakers Bureau, of which I am a part of, is to tell our stories far and wide, because we break the myths and the stereotypes as to what causes homelessness. As the gentleman before me said, I almost nodded my head off because affordable housing, or the lack of it, is the #1 cause of homelessness. And the stereotype is that the lower classes, or the uneducated, or the mentally ill, we like to call it the lazy, crazy, and drug addicted. But I beg to ask any one of you all if you might know someone who lives in a home that still experiences those three things. It is not a problem that only the individuals who are homeless experience, and I'd like to make that a point quickly. My personal story is such that I never saw homelessness in my future, and I had preconceived notions as to who and what the homeless were until it happened to me. I happened to become ill and then suffer a divorce in almost the blink of an eye. And before I knew it, I was at a shelter. I didn't even know shelters existed. And the individuals that I thought that I would meet there, let's just say my expectations were shattered. There was a doctor there that had fell on hard times, and she went to work every day at Georgetown Hospital. There was a journalist there from the Washington Post, and a few other individuals that you would not have expected. Because, see, homelessness does not discriminate against anyone. I'd like to say that the Housing First program is the thing that saved me. In Housing First, it is designed for individuals who are homeless to get a place that is then subsidized until they can do better, or if they have diagnoses as illnesses or dual diagnoses such as mental illnesses, they get an opportunity to stay there for life. Now, the thing that I noticed being a recipient of that program is that we're viable members of society. Many people go on to work towards advocating for homelessness and poverty in general. And it surprised even me. I remember speaking to a group of individuals at Villanova University, and the gentleman hearing my story could not contain himself. He's like, she's just like us, you know? And I don't know what he expected, but yes. We also shouldn't forget that with the disasters that are befalling our country, that these disasters also bear people towards homelessness. You know, I believe the statistic says 10% of the individuals who become homeless from fire, flood, or whatever natural disaster have you stay that way. And we have to do something about that. All right, because when the individuals that make up this country, the middle class, falter, this country falters, and we can't afford that. We really can't afford that. So I'd like to say something that I've always said whenever I speak to people, and it's this. I believe that the opposite of wealth was poverty. It's not until I experienced this myself that I believe and now understand that the opposite of poverty is justice. I urge the robust conversation on this topic. I urge it. It is happening to more and more individuals as time goes on, and you'd be surprised at the individuals that I speak to all over the world and all over the country that say the same thing. So if we could get a handle on that by starting this conversation, it would be great. Again, it's my pleasure to be here. I thank you, and I urge all questions or any questions afterwards. I'd be more than happy to help. Thank you very much.
Thank you, Dr. Lucas. You are now recognized for 5 minutes to give an oral presentation of your testimony.
Good morning, Chairwoman Waters, Ranking Member McHenry, and members of the committee. Thank you for inviting me to testify today. My research focuses on analyzing efforts to end homelessness in our nation, and so I'm honored to speak with you on this topic. My present testimony cannot address all of the intricacies of this very important issue, but I can speak to 3 considerations based on my research and on the available evidence. The first point is that we do not yet know how to end homelessness. Second point, the homeless problem varies widely across communities and individuals, reducing the likelihood of a universal solution.